females. And so we do a lot of testosterone replacement in women, and there's multiple options of testosterone replacement. There's creams, there's dissolving tablets, there's troches, and there's pellets. But what I tell all of my women is that for some reason pellets are the most effective. And so I have women that will choose creams or dissolving tablets, but inevitably if they ever try pellets, then they will feel tremendously different. It's something about the sustained level of the testosterone from the pellet that's different than when you do the cream and you apply the cream, your level goes up and it goes down. Or if you do the dissolving tablet, your level goes up, goes down. So we can get adequate levels from creams and dissolving tablets, but it doesn't seem to have the same benefit as the pellet does. The pellet is a small surgical incision that we make in the back of the butt, and we implant. It's like a crystallized testosterone pellet underneath the skin. It's really small. It's like 2 grains of rice, basically. And basically it just dissolves under your skin for 3 to 4, up to 6 months, releasing its testosterone night and day, all day long at a real consistent, steady level. And that consistency seems to have the most benefit, and the benefits of testosterone as far as the building muscle and losing fat and increasing your libido, decreasing your anxiety, improving sleep. I could go on. But testosterone pellets are a very effective, most beneficial treatment for perimenopause symptoms. So if you're a woman in that kind of 35 to 50 age range feeling some of those perimenopause symptoms, so perimenopause, one of the hardest things to treat is fluctuating hormones. So it's way easier to treat you after you're in menopause, but there's definitely a few tricks we can use before you enter menopause. One of our favorite ones to use is actually testosterone pellets. The idea is that in the fluctuating hormone times of estrogen, progesterone cycling up and down because of perimenopause being unstable, what we can do is we can do elevated levels of testosterone above natural levels in order to kind of tickle the estrogen and progesterone receptors whenever the estrogen and progesterone might be too low. So the idea is that estrogen, progesterone, and testosterone, they all sound very similar. They look very similar. So they can each tickle the receptor when one is gone. So the idea is we boost your testosterone levels using hormone pellets. You can look more about hormone pellets, but we boost the testosterone level so that when the estrogen and progesterone tank, because the ovaries stop making it, the testosterone can fill the gap and help stimulate the receptors so you don't feel as low. In addition, testosterone helps build more muscle, lose more fat, helps decrease the anxiety, which we discussed is one of the common side effects of perimenopause. And of course, helps with libido and sex drive. So one of the frequent things we do is put our perimenopausal women on testosterone replacement in pellet form. And then we can also use other things if night sweats, hot flashes are kicking in. So with night sweats, we can use progesterone. You take progesterone at night, helps you sleep and helps with the night sweats. And then if estrogen is becoming a problem, then you might be getting closer to menopause and need estrogen replacement. But we use supplements like Estrovera from Metagenics or Primrose Oil. Or DIM Detox from Pure Encapsulations. There's multiple DIM products. That's my favorite DIM product. Then, of course, anxiety is a common symptom. So if you're not doing the testosterone, then we can use stuff like liposomal neurocalm from Designs for Health. This is a common one we use. It's just a pump under the tongue that helps chill you out and relax things. So there are many symptoms of perimenopause that can sneak up on you and think it's just age-related or came out of the blue. But if you do these treatments, you will feel better, and then you can make it through menopause with less suffering.